Assessing a patient is never one size fits all. The same vital sign, symptom, or behavior can mean very different things depending on age. Pediatric and geriatric patients sit at opposite ends of the spectrum, and nursing assessment must adapt accordingly. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Many students assume assessment techniques are universal, and only the normal ranges change. In reality, age affects physiology, communication, mobility, and risk. Pediatric patients often cannot explain what they feel, while geriatric patients may underreport symptoms or present atypically. Nurses must adjust how they observe, question, and interpret findings. Think of assessment like reading two different languages. The words may look familiar, but the meaning changes based on context. A fast heart rate in a child can be normal. The same rate in an older adult may signal serious stress. Nursing assessment depends on understanding that context. At the bedside, pediatric assessment begins with observation. Nurses watch behavior, activity level, breathing effort, and interaction with caregivers. Children may not describe pain clearly, so facial expressions, crying patterns, and body movements provide essential information. Geriatric assessment, on the other hand, focuses heavily on baseline function. Older adults may have chronic conditions that mask acute illness. Confusion, weakness, or a fall may be the only sign of infection or dehydration. Nurses must recognize subtle changes from the patient's usual state. Physiological differences shape assessment priorities. Children have faster heart rates and respiratory rates, smaller airways, and limited reserves. They can deteriorate quickly. Older adults often have reduced organ reserve, slower healing, and increased sensitivity to medications. Both groups require careful monitoring, but for different reasons. Communication also changes. Pediatric patients may rely on caregivers to provide history, while geriatric patients may have hearing, vision, or cognitive impairments. Nurses adapt by using simple language, allowing extra time, and confirming understanding. Across healthcare settings, age-appropriate assessment improves safety. Pediatric dosing errors, missed signs of dehydration, unrecognized delirium, and overlooked mobility risks are common causes of harm. Nurses play a key role in preventing these outcomes through tailored assessment. The NClex reflects these differences by testing age-specific findings and priorities. Questions often ask which assessment is most appropriate for a child or an older adult. The correct answer usually recognizes developmental stage and vulnerability rather than applying adult norms universally. In real nursing practice, strong assessment means knowing when to adjust expectations. Nurses do not compare children to adults or older adults to younger ones. They assess each patient within their age-related context and respond accordingly. Now that you understand how assessment changes across the lifespan, the next step is applying this thinking to metabolic emergencies, where age, physiology, and rapid intervention intersect. That becomes clear in diabetic emergencies, and that's exactly where we'll go next here at the Learning Studio.